Treatment of pleural mesothelioma. There is no cure for pleural mesothelioma, but there are treatments that can help to prolong life and improve quality of life. These treatments may include surgery, chemotherapy, radiation therapy. The type of treatment that is best for you will depend on the stage of your cancer and your overall health. Prognosis of pleural mesothelioma. The prognosis for pleural mesothelioma is poor. The average survival time after diagnosis is about 2 to 8 months. However, some people with the disease may live for many years. Lifestyle changes. There are a few lifestyle changes that you can make to reduce your risk of developing pleural mesothelioma. Avoid exposure to asbestos. If you have been exposed to asbestos, get regular medical checkups, quit smoking, eat a healthy diet, exercise regularly. There are many support groups available for people with pleural mesothelioma and their loved ones. These groups can provide emotional support, information, and practical advice. If you have been diagnosed with pleural mesothelioma, I encourage you to reach out to a support group. These groups can make a big difference in your peritoneal mesothelioma. Peritoneal mesothelioma is a rare and aggressive form of cancer that affects the peritoneum, the thin membrane lining the abdominal cavity. It is primarily caused by exposure to asbestos, a naturally occurring mineral once widely used in construction and various industries. When asbestos fibers are inhaled or ingested, they can become trapped in the body, leading to the development of mesothelioma in the peritoneum or other areas such as the pleura, lining of the lungs. Symptoms of peritoneal mesothelioma can be vague and non-specific, often resembling other gastrointestinal conditions. Common symptoms include abdominal pain or swelling, unexplained weight loss, changes in bowel habits, nausea, and fatigue. Due to its rarity and similarities with other illnesses, diagnosing peritoneal mesothelioma can be challenging, often requiring specialized testing and imaging techniques. Treatment for peritoneal mesothelioma may involve a multimodal approach, combining surgery, chemotherapy, and/or radiation therapy. The goal is to control the disease, alleviate symptoms, and extend the patient's life. In some cases, surgery may be performed to remove the tumor and affected tissues, followed by chemotherapy to target any remaining cancer cells. Intraperitoneal chemotherapy, where drugs are directly administered into the abdominal cavity, is a common approach for this type of cancer. Clinical trials and emerging treatments, such as immunotherapy, are also being explored to improve outcomes for patients with peritoneal mesothelioma. It is important to note that prevention is crucial when it comes to mesothelioma, as there is no safe level of asbestos exposure. Asbestos has been banned or restricted in many countries, but there are still cases of exposure due to its presence in older buildings and products. If you suspect exposure to asbestos or experience any symptoms related to peritoneal mesothelioma, it is essential to seek medical attention promptly. Early detection and intervention can greatly improve the prognosis and quality of life for those affected by this disease. Pericardial mesothelioma. Pericardial mesothelioma is an extremely rare form of cancer that affects the pericardium, which is the thin membrane surrounding the heart, known as the pericardial sac. Like other types of mesothelioma, it is primarily caused by exposure to asbestos, a mineral once widely used in construction and various industries. When asbestos fibers are inhaled, they can become lodged in the body, leading to the development of mesothelioma in the pericardium or other areas such as the lungs or abdominal cavity. Due to its rarity, pericardial mesothelioma is challenging to diagnose and treat. Symptoms can be vague and often resemble other heart-related conditions, making it difficult to identify without specialized testing and imaging techniques. Common symptoms of pericardial mesothelioma may include chest pain, shortness of breath, heart palpitations, and fatigue. Because it is an aggressive form of cancer and often diagnosed at an advanced stage, Treatment options for pericardial mesothelioma are limited. The primary goal of treatment is to relieve symptoms and improve the patient's quality of life. Treatments may involve surgery, chemotherapy, and/or radiation therapy, depending on the individual's specific case and overall health. Surgical intervention may involve removing the tumor and affected tissues in the pericardial region, but due to the delicate nature of the area, surgical procedures can be highly complex and risky. Chemotherapy and radiation therapy may be used to shrink the tumor and alleviate symptoms, but they are generally considered palliative treatments to manage the disease rather than curative options. Research into new treatment approaches, such as immunotherapy, is ongoing, but due to the rarity of pericardial mesothelioma, large-scale clinical trials are challenging to conduct. Prevention is essential when it comes to mesothelioma, including pericardial mesothelioma. Asbestos exposure should be avoided, and safety measures should be taken when dealing with materials containing asbestos. While asbestos has been banned or restricted in many countries, it is crucial to be cautious, especially in older buildings or products that may still contain this hazardous material. If you suspect exposure to asbestos or experience any symptoms related to pericardial mesothelioma, it is crucial to seek immediate medical attention from healthcare professionals with experience in diagnosing and treating this rare condition. Early detection and intervention may improve the prognosis and provide better management options.